am a pediatrician. My very first day as a brand new resident physician in pediatrics, I was assigned to the emergency room. An ambulance rolled in with a baby receiving cardiopulmonary resuscitation. He had no heart rate, he was not breathing. We continued the code in the emergency room, but the baby did not survive. The lovely young parents were, as you can imagine, beyond anguish. The mother sat for the longest time in the corner of the emergency room, rocking her baby and singing, "Eric Baker, I love you." I sat nearby and bawled. I would have never imagined then that 40 years later, these sorts of deaths would be linked to the air pollution that causes climate change. Yes, air pollution increases the number of infant deaths. But I get ahead of myself. I love babies. I've cared for babies and their grown-ups for my whole career. The joys of working with families overshadows the occasional tragic diagnoses or deaths. Pediatricians care about the whole child and the whole family. So while children come to the hospital when they're sick, we as pediatricians are thinking about ways to avoid more hospital visits, how to protect children from the onset. We work to protect children in the exam rooms, but also in the school rooms, in legislative hearing rooms, and sometimes even in courtrooms. We fight for issues that affect the kids' health and safety and lives, like seatbelt laws and vaccines and affordable childcare and school lunches. The list goes on and on. But now there's another topic that requires pediatricians to advocate for kids because it's affecting their health, their safety, and their lives: climate change. We've known for a long time that air contamination affects children with asthma. I doubt that's news to any one of you. We now actually know that air pollution causes some children to develop asthma that would not have developed it otherwise. Those air pollution contaminant particles that we call particulate matter, they enter the lungs and they damage the lungs. But the tiniest particles, as you can see to the left of the red blood cell, are smaller than the red blood cell, and they can get beyond the lungs. They can get into our bloodstream and go everywhere in our bodies. Our blood-brain barrier cannot keep them out of our brains. The placenta cannot keep them out of our unborn babies. And we used to think the placenta protected the fetus from everything. So our bodies produce inflammation to try to destroy this particulate matter, but that has its own set of problems. When pregnant women breathe polluted air, research indicates that they're more likely to deliver stillborn babies, babies with certain birth defects, and have babies that are more likely to die in the first 6 months of life. What we used to call crib deaths, but we now call sudden unexplained infant deaths, like the child at the beginning of my story. Pregnant women breathing bad air is also linked to increases in attention deficit hyperactivity disorder and autism in the babies. Heat is another issue. The increase in greenhouse gases in the atmosphere is causing global average temperature to rise and causing more hot days and more extreme heat events. This too can cause more preterm births and stillbirths. Even just a few days over 90 degrees has been linked to increases in these outcomes, and we have a lot more days like this now. Increased heat has been linked to increased violence, including child abuse and spouse abuse. Increased heat makes our kidneys work harder, and we're finding more unexplained kidney disease in young, healthy outdoor workers. And heat affects our ability to learn in school and perform tasks on the job. Lastly, climate change causes despair. In 2024, 15,000 US youth were surveyed across all 50 states. 85% of them were at least moderately worried about climate change. And over half of them are considering not having children because of climate change. All of these things is why pediatricians care about climate change. Over the past decade, the face of climate change has changed from polar bears to children. And I think that's been a good trend because I think everybody cares about children and health. In fact, one of the most prestigious medical bodies on the planet, the Lancet Commission, has called climate change the greatest threat to public health of this century. But when people talk about climate change, which by the way is not often enough, the impression for many of them seems to be that one, this happens to someone else and somewhere else, or two, Because of the greenhouse gases in the atmosphere, it will take decades to lower the temperature, so why bother? And 3, I am too insignificant to make a difference. I would like to refute all of these ideas. Climate change is happening here and now, and it's happening to you and I and our health, and to our mothers and our infants and our babies. 2, yes, lowering the global average temperature will take time, but making efforts to lessen greenhouse gas emissions still matters because of human health. Almost any action taken to lower greenhouse gases also decreases the amount of pollution in the air. When we lessen the burning of fossil fuels in an area, the air clears very quickly and human health improves. We saw this in Los Angeles a couple decades ago. I-405 was closed for repairs for 1 day. They called it carpocalypse. The air quality within minutes improved for 100 miles around, up to 83% in some areas. The 911 calls and the ER visits that day went down significantly. Similarly, in the Atlanta Olympics in 1996, they limited traffic across the city because of air pollution issues. During those weeks, asthma visits to the pediatric emergency rooms dropped by 40%. The third and last point, I'm too insignificant to make a difference. Dr. Steve Running, Nobel Prize-winning scientist from the University of Montana, noted in a Montana court trial a couple of years ago related to climate change that every ton of CO2 emitted matters. So, what can we do? Well, personal actions are good in that they set an example, but what we really need is collective action. So it's great to ride your bike to work, but it's much more powerful and much better to work on policy in your city or town that promotes bikes and bike lanes and bike policy. When we improve our transportation system and the walkability and the bikeability of our towns and cities, we improve human health. Did you know that when a person transitions from driving their car to work to taking public transportation, on average, the first year they lose 9 pounds. This has enormous health benefit, especially when half of us are overweight and half of us don't get the minimum recommended amount of exercise. When we emphasize regenerative and local agriculture, our food is healthier, so we are healthier, and greenhouse gases and air pollution is decreased. When we plant and protect trees, they have lots of benefits related to the climate. They remove CO2 from the air, they remove air pollution, about 200 pounds of air pollution per average tree per year. And they protect our infrastructure and our homes from the increasing extreme weather events that we're seeing by absorbing some of the extra moisture. But there's great health effects. Our mental health is improved just by seeing trees. And researchers have found that comparing equal socioeconomic neighborhoods, one with trees and one with far fewer trees, the people that lived in the tree area have less diabetes and less obesity, just because they get outside a little bit more and get a little bit more exercise. There are so many groups working on these problems in Montana that it might surprise you, and I'm sure I haven't listed a fraction of them. And there's so many meaningful activities that all of us can do. I would conjecture to say that for each one of you and myself, there are things that we are passionate about that we can work on, that need doing, and that help address climate change. And you can do that whether you have 15 minutes a week or 40 hours a week. And whether your passion is trees or bikes or farmers markets or the sustainable fashion industry, whether your vocation is teaching to any age on any subject, or ministry or medicine or agriculture or construction, there are things we can incorporate into our vocation and our avocation that will make a difference for the climate. If you can't think of anything else, you can email or call your 3 congresspeople every week, and that only takes 15 minutes, and it does make a difference. Earlier in the talk, when I noted that the Lancet Commission called climate change the greatest threat to public health of this century, I left something out, because they went on to say that tackling climate change could be the greatest global health opportunity of this century. Thank you.